Good afternoon. Today we will discuss about anatomy of the scrotum. The scrotum is a fibromuscular cutaneous sac located between the penis and the anus. It is dual chambered, forming an expansion of the perineum. Embryologically, the scrotum is derived from the genital swellings. During development, the genital swellings fuse in the midline. In the adult, this fusion is marked by the scrotal raphe. The scrotum is biologically homologous to the labia majora. See, this labia majora is present in the female reproductive system and female perineum. In this article, we shall look at the anatomy of the scrotum. It contains blood supply and innervation. The scrotum contains three major paired structures. The scrotum contains three paired major structures. First one is the testis. We have the pair of testis here, and epididymis. You can see the epididymis here, testis, pair of testis, and pair of epididymis, and spermatic cord. Pair of spermatic cord. The scrotum contains three structures. All these three structures are paired structures: testis, epididymis, and spermatic cords. The testis is the site of sperm production or spermatogenesis. Epididymis is located at the head of each testicle. It functions as a storage and reservoir for sperm. And spermatic cord, a collection of the muscle fibers, vessels, nerves, and ducts that run, run to and from the testis. There are also muscle fibers located within the scrotum. The dartos muscle is a sheet of smooth muscle situated immediately underneath the skin. It acts to help regulate the temperature of the scrotum by wrinkling the skin. This decreases the surface area, reducing heat loss. Neurovascular supply. The scrotum receives neurovascular supply from the nearby vessels and nerves. The scrotum receives arterial supply from the anterior and posterior scrotal arteries. These anterior scrotal artery arises from the external pudendal artery, while the posterior is derived from the internal pudendal artery. The scrotal veins follow the major arteries, draining into the external pudendal veins. Nerves. Cutaneous innervation to the scrotum is supplied via several nerves according to the topography, anterior and anterolateral aspect. It derived from the genital branch of genitofemoral nerve and ilioinguinal nerve. The posterior aspect. The posterior scrotal nerves derived from the perineal branch of the pudendal nerve and posterior femoral cutaneous nerve. Lymph fluid from the scrotum drains to the nearby superficial inguinal nodes. And coming to the clinical anatomy, hematoma of the scrotum. Hematoma may develop in the scrotum as a result of scrotal surgery or trauma to the genital region. This results in swelling and discoloration of the scrotal skin. Occasionally, the origin of bleeding may not arise from the scrotal contents but from the basal part of the penile urethra, as in the straddle injuries. Direct perineal trauma, like when falling onto a bicycle crossbar. This is the hematoma of the scrotum.